the overall headline that 12 to 15-year-olds in Canada are going to be able to get the vaccine very soon, one of the first countries in the world. What's your overall perspective on that?
Yeah, big news for parents, for pediatricians, for those involved in the care of children. It's really very reassuring data, amazing efficacy, showing how robust children's immune systems are, and no new safety concerns. And I think that, it's really great. And the reason kids should get protected is that even though we've seen smaller numbers of severity and hospitalization and death in children, now if you look, some of the provinces, up to 30% of their active cases are in kids under 19 years of age. Therefore, now we're seeing more kids hospitalized, some kids in ICUs. And we also know that this is going to be that extra step for community protection. Kids have suffered a lot with the restrictions, with not being able to have in-person schooling. And lastly, for me, as an infectious disease specialist, what we are also seeing post-COVID is that some kids may have mild disease, and yet they would have this multi-system inflammation, long-term effects, a situation where the heart can be affected. So being able to prevent that and to protect our kids is really, really big news.
And thank you for explaining why it is to you. I'm just wondering, we got the announcement from Health Canada yesterday morning, so we're about 24 hours since, and we got word that Alberta will be opening up the eligibility to this age group as of this coming Monday. So that's the province where you are. I'm just wondering, have there been more calls from parents wondering about it, asking questions about what's going to happen on Monday or anything to that effect?
Yeah, so I've spoken to some of my colleagues as well who do emergency care and pediatrics, and I actually had a vaccine hesitancy clinic yesterday, and it's on everybody's mind right now. People are asking about the COVID vaccine, wondering how to take it. A lot of parents, as you probably know, in Alberta, it was offered off-label as of last week as well for kids with chronic conditions. A lot of parents trying to ensure that their kids are getting protected. So right now we're seeing a wave of confidence and a lot of parents wanting to protect their kids. And most of the questions are, how do we do it? And what's the accessibility issue right now?
Well, we will find those answers out on Monday when things really open up. I have questions for you, Dr. Constantinescu, from our viewers today, and they're not really related so much to the 12 to 15 age group. They are more on vaccination more generally. Why don't I begin with an account on Twitter under Choir. If someone experienced facial numbness after the first shot of Pfizer-BioNTech, should they have the second shot of that vaccine?
Yeah, so there's been initially in the early study, there was a question about Bell's palsy around this vaccine. They had looked at that particular question and that effect in the actual clinical trial and then later on in surveillance data, and they hadn't seen a safety signal with the vaccine, meaning that the number of people who had this Bell's palsy seemed to have the same it was the same rate of occurrence in those vaccinated and unvaccinated. And this is the first thing that this made me think of when they were asking about numbness. However, anytime you have a concern about a reaction from a vaccine, please see your provider and your healthcare provider, your physician, because you want to make sure you get a full assessment of what that might have been and what could have caused it. So many things can cause facial numbness. Have that assessed. Write down all of your symptoms as you remember them, including the time from the vaccine when it might have happened, and have that properly looked at by a physician to ask that particular question as it pertains to you.
Here's something else in terms of reaction and side effects, and this is about the AstraZeneca vaccine. Of course, we've been discussing at length the extremely rare blood clot that is now linked to that vaccine. Is the risk of blood clots after the first vaccine of AstraZeneca different from the rate after the second dose?
Now, that's a fantastic question, and now we have a bit of an answer to that. So a lot of the data are still evolving around this, but it seems that with the first dose, that occurrence rate that people have mentioned about the 1 in 250,000 to about 1 in 100,000, it seems that with the second dose, this seems to be a lot less, so about 1 in a million. Now, that being said, the number of people who've had their second dose, the denominator, the whole pool of people we look at is smaller as well. So more will come on this. But right now, what we know is that it seems to be a lot less risky on the second dose.
So obviously, after the NACI briefing this week and the confusing messaging over this type of vaccine, this in the J&J, as compared to Pfizer, BioNTech, and Moderna. There are a lot of questions associated with that. I want to get your thought on that in just a second. But one from CJ. Kevin, by the way, thank you for your last question. CJ writing that she received the AstraZeneca as her first vaccine in mid-March and has been fairly optimistic, has had no regrets. Since the NACI messaging, she has decided, I will not take a second dose of AstraZeneca. So wondering about research coming on the mixing and matching. And a similar question from Mary. So I'll tie the two of them together. 61-year-old woman who had one shot of AstraZeneca. And now, of course, that she said was before the real blood clot story was coming out. Can she let the AstraZeneca vaccine wear off and then get her second dose of something else?
First of all, I just want to say to both of those viewers, thank you. Thank you for making a smart choice to protect yourself and your families and to get us all closer to community protection. The question on whether or not you can get a different vaccine is also looked at very carefully in a number of studies right now. These mix and match studies are underway. The results on that might come late May, early June. The studies will keep on going for a number of months, but we'll get some preliminary results soon. So we're looking hopefully within a month to 2 months. Some experts are saying that having one dose of a vaccine and then a second dose of a different vaccine might actually show that it might be a bit more beneficial because it might stimulate more than just one branch of the immune system, potentially a more robust response to the immune system. So there is some what we call biological plausibility that the mix and match might actually be beneficial. But the actual results on that are underway. Studies are happening with different types of variations. So stay tuned because we'll know more. These results are going to come soon.
Can I get your take on that as well? Because last time we spoke to you, Dr. Constantinescu, you were wearing your T-shirt, "This is our shot," urging Canadians to get whatever vaccine is offered to them in order to get the percentages up. So after the briefing on Monday and the confusion that ensued, I'm again wondering what happened in your case, with your circles in your practice. How did people respond to that confusion in reaching out to you?
Yeah, so, through this whole pandemic, we've seen that whenever there is any miscommunication or whenever some information is taken out of context and amplified on social media, it just really shakes people emotionally and leads to a lot of anger and fear, and those things are at the root of vaccine hesitancy, this emotional response. So what we have heard since this whole discussion about NACI in the media is a lot of people are asking for validation. They're saying, have I made the right choice having taken this vaccine? And that seems to have resonated more this week than before. And I don't think that overall vaccine confidence has taken a hit because at the end of the day, people make decisions looking at their own personal situation, at the threat of COVID in the third wave, and at their, the benefit of having protection earlier on. And we know, and we've always said this, in some ways this is not news, we've always said it's really important to get protected as soon as you can because the risk of waiting, the risk of death and hospitalization from this third wave is much higher than the risk of a rare clot from AstraZeneca, which is why this is still a really good vaccine to take and that it may save lives when it comes to that. And what I also want to say to people is right now, here we are in this first week of May, and we are busy closing down and coming in with new restrictions. And you look at places like the UK, where they have vaccinated 60% of their vaccinated people are with AstraZeneca, and they're publishing their opening plans. So this is still you've made a smart choice, protecting yourself, your family, and you're getting us all closer to, that hope of being able to open things up and have protection as a country.